Hello, my name's Angus Thomson. I trained as a molecular geneticist, but for the last 15 years, I've been working on vaccine acceptance and uptake, working with experts in the fields of human behavior, social and cognitive psychologists, anthropologists, and the like. I'm currently principal of Irimi Company, a small boutique consultancy that focuses on supporting countries to raise vaccination coverage rates and to address vaccine hesitancy. And I'm adjunct clinical professor at Indiana University, where I have a number of collaborations. So we've seen a very dramatic impact of COVID-19 on routine immunization. We already had many kids around the world who missed out on all the basic vaccines, so-called zero-dose children. Before the pandemic, there were in the order of 20 million every year who were not being reached by vaccines and so were remaining unprotected against the deadly and debilitating diseases that vaccines protect us against. We know from a study from the WHO and UNICEF that during the pandemic, an additional 3.7 million children have missed out on basic vaccines. That means diphtheria, tetanus, and pertussis, and measles. We can essentially say that in a single pandemic, we have lost all of the significant gains that were made in terms of increasing immunization rates globally in the last decade. And this is having very real consequences. We are seeing outbreaks of vaccine preventable diseases across the world that can be linked to this failure to reach children with vaccines during the pandemic. Zimbabwe is dealing with a devastating measles outbreak at the moment, with over 6,500 cases and over 700 related deaths. We're seeing polio cases emerging in South and West Africa, and even in the US, with poliovirus now being detected in sewage in Israel and in London. This virus, the poliovirus, has already paralyzed almost 300 children this year. So the pandemic has had very serious consequences in terms of outbreaks, and it has also presented us with a major challenge because in addition to those zero-dose children, we now have what I call a lost cohort of children who have emerged from the pandemic either unvaccinated or under-vaccinated and are therefore not protected against many of these diseases that are always out there, always looking for a hole in our immunity, in our collective immunity, to break through and infect children.